Hi, I'm Tim Quilty, Liberal Democrats member for Northern Victoria in the Victorian Upper House. If you're one of the newly avid followers of Victorian politics, or if you've been paying attention to my social media, you may have heard about the government upcoming health legislation amendment information sharing bill. The bill is to compulsorily put the medical records of every Victorian, and presumably those from other states who are part of the Victorian hospital system, like Albury, onto a centralised government database. The government tried to ram this bill through the lower house on October 6 last year, without briefings or debate. A ministerial advisor was quoted at the time as saying, well, we haven't got a lot of time to prepare this. Alarm bells should have been ringing then. I imagine your alarm bells might be ringing right now. This bill stems back to findings from the Targeting Zero report, which was commissioned due to the unacceptably high rate of perinatal deaths at the Bacchus Marsh Hospital. The report produced two key findings: that the health department should invest in modern data management systems by developing a statewide patient identifier and electronic patient record system in hospitals, and that by 2021 all major hospitals should have a fully electronic health record that enables sharing of patient information between hospitals. The government has realised that they can probably reduce deaths and also bad media coverage by creating this health record system. But the way they plan to do it is by overriding your consent and your privacy. Now, I'm all in favour of improving inefficient systems and processes, and in theory, digital record sharing should indeed reduce deaths. But if this is to be done, it should be patient-centred, where you, as a patient, have the right to inform any hospital in the state what you wish to about your medical history. We know from the past 2 years that the Andrews government doesn't believe in the concept of consent. To be blunt, I don't trust any government to manage these records safely. But I really don't trust the current Victorian government. I don't trust them with anything, but especially with personal data. How many ways can they misuse it? Now, if they had your vaccination data compulsorily in the last 2 years, they wouldn't have had to rely on the federal government's health records to enforce their vaccine mandates. The abuses are obvious. Now, there's an easy remedy to all of this. We make the system optional. If you think back to the federal government's My Health record, when it was being set up, people were allowed to opt out, and approximately 10% of the population chose to do just that. In contrast, the system the Andrews government is proposing does not allow for people to opt out, nor does it allow patients to view and control access to their medical records. Given that this bill completely overrides your right to consent, the Liberal Democrats will be putting forward amendments. We are asking that there be a mechanism to allow individuals to consent to their inclusion on the register and opt in, and that individuals' health information is only collected, used and disclosed in accordance with that individual's consent. Now, further to this, you may have seen I put a link up to a petition for Victorians who oppose this bill. The petition calls on the government to immediately withdraw the health legislation amendment bill until further consultation is done, focusing on how consent can be included into the reform. I'll include a link to that in the text to this video. If the government were to accept the Liberal Democrats' amendments, we would not oppose this bill. But as it stands, the legislation tramples on any concept of medical privacy, and we will fight to stop this being rammed through. The bill will be debated shortly in the Legislative Council. If you can, I urge you to contact your local Legislative Council members to voice your concerns over this bill. Everybody, please sign and share the petition wherever possible, and keep fighting alongside us to protect the freedom and liberty of all Victorians.